Dear friends, I am Dr. Deepak Chaudhary, Principal Director and Head Department of Arthroscopy and Sports Medicine at BLK Max Hospital. Bankart repair for recurrent dislocation shoulder has become the standard of care in young patients who have experienced repeated dislocations. There have been a lot of advancements in terms of better implants over the past few years, making this procedure predictable and clinically reproducible. One of the recent advancements in this field has been the the implants which are basically retensionable and knotless. And in this context, Arthrex has come up with FiberTech technology of using these knotless anchors. And the biggest advantage of these anchors is that they are reproducible and very easy to use. So you don't have to tie all those knots, and in which there is an issue of whether the tension is proper or not. So with this technology, the anchor has got one loop wire, there is another repairable wire, and the third is the shuttling wire. So once we pass that repairable wire through the loop, and it becomes very easy, just by the pulling or the shuttling wire, you can tie the knot, and you can readjust. The biggest advantage is you can readjust the tension. If you feel that the tension is not proper, you can readjust, and it is very simple to use. And we have been using it for the past few months, and we find that the results are very excellent, and it makes the process very short, in the sense that operating time is reduced, and it takes hardly 2 or 3 minutes to fire one anchor. With this background of having done about 20-25 cases over the past few months, I strongly recommend that use of this FiberTech retensionable knotless technology, especially for shoulder Bankart's repair.